guys know me, but it's my turn to see if I can figure out how to use the pointer. This is Christopher. Not to embarrass my son, he did raise his hand. So we're going to talk a little bit about advocacy. First thing that I wanted to mention, and just throw out there is the fact is that we are all advocates here on a day-to-day basis. Advocacy is about education. And so whether we like it or not, we've been thrown into the world of advocacy, whether that is advocating for yourself at your medical appointments, whether it's advocating for your kids in the classroom, whether it's advocating for yourself in the grocery store line as the cashier asks, why are you buying 10 packages of fat-free cheese? Well, in Atlanta, there is one store, believe it or not, that has fat-free cheese. And so we stockpile when we go. And so they always get to hear about LCHAD and why we use fat-free cheese. And so the beginning of advocacy is education. So there's that component of advocacy, but then there's this whole separate component, political advocacy. And that's a little bit what I wanted to talk about today, is diving into the world of political advocacy. And, for me, it was never something that I thought I would dive into. But about 13 years ago, I was at a conference like this, and my friend, a person who was not my friend then, who's become a dear friend now, Kristen Vonix, she came up and she spoke, just like I'm speaking now, about her experience, not only with political advocacy, but their push to try to get something called the Medical Nutrition Equity Act passed. And so when I listened to that conversation, I was inspired because when Christopher was born, he was diagnosed at birth with LCHAD. And when we got home about 4 months in, we realized that our insurance would not cover the cost of his medical life-saving formula. And that kind of thrust us into this world of advocacy. And we were lucky because my husband was a teacher. Now, it was terrifying because my husband was a teacher, trying to think, how are we going to cover $800 to $1,000 a month for his medical formula? But because he worked for the state, we were able to reach out to the appropriate people and get coverage for Christopher for his formula. But I wondered at the time, what about families that aren't as lucky as ours? And then I heard Kristen speak and learned about the Medical Nutrition Equity Act and how they were trying to pass legislation to encourage private insurance companies to cover the cost of medical formulas, and the PKU community and the FEOD community. And I thought, this is brilliant. I need to get involved somehow. And so it was at that moment that I contacted Kristen. And again, I knew nothing about political advocacy. All I had was a desire to change, a desire to educate, and a desire to help other FAOD families who might be experiencing coverage issues like mine. And really, that's all it takes to start with political advocacy. And a little bit of education. So I will say that Kristen was amazing in the sense that, again, I was a blank slate. I think maybe in 9th grade, I passed my course learning about legislation and stuff, but it had been a long time. And so Kristen really kind of walked alongside me and was able to educate me about how the systems work. And I throw that out there to say, if you're here today and you've never called your legislator before, that's part of why I'm presenting today, is I want to give you just kind of a brief overview, like Kristen did with me, about legislation and laws and how to get involved. You do not have to have experience to contact your legislators, but it's super, super important. And there's lots of different little things that you can do to get involved. And if you're a clinician or a physician, it's the simple things that you can do to have your patients get involved in this arena as well. So when you're thinking about starting to dive into political advocacy, the first thing that I want to mention is the structure, right? We have federal legislation and we have state legislation, and we also have local community legislation. But we're going to focus on federal legislation and state legislation today because in regards to changing medical systems, doing it on a local basis, it doesn't affect it quite as much. And so again, we have federal legislation and state legislation. So state legislation affects what's going on in your state. And the state of Colorado has different rules in regards to what they cover for medical foods and formulas and supplements. Georgia's the same way. And a lot of times when you start trying to pass a bill, there will be several different similar bills in the state. And it's helpful when you're trying to get bills passed through federal legislation. It's helpful when there's state legislation put in place, because then when you go to your federal representatives, they're like, oh, okay, a number of states are already on board, so we can kind of go ahead and move forward. And that's kind of where we're at right now with medical nutrition. There are a number of states that will cover the cost of medical foods and nutrition. But again, it's confusing because it depends on the state. And then the problem becomes, if I work for a company and I live in the state of Georgia, but my insurance is out of California and they have different rules, then coverage can become tricky. So that's really important. That's why it's really important to not only get laws passed at the state level, but also the federal level. And so the federal level covers laws all throughout the United States. And that is kind of where we're at with Medical Nutrition Equity Act right now, is we're trying to get this piece of legislation passed all throughout the United States. And so when you start diving into policy and trying to get things passed, the first thing you want to ask yourself is this a federal law or is this a state law? And the reason you want to ask yourself that question is because these are two different groups of people that you'll be talking to. I had a dear friend recently say, view your legislators as people that you can educate, right? She's like, so with that, and when you consider that, on the federal level, we each have 2 senators. And so that means that in this room, in the Senate alone, just for federal, we have 50 people we can educate. We have over 400 people we can educate in the House, and that's just on the federal side of things. So in federal legislation, everyone in here will have 2 senators that they can talk to per state. And it's the same 2 senators. So it doesn't matter where I live in Pennsylvania now, it used to be Georgia. No matter where I live in Pennsylvania, I'm going to have the same senator as my sister-in-law, same 2 senators. Now the House of Representatives works a little differently. My House of Representative is going to be different than my sister-in-law, who lives 2.5 hours away. And so it's important to realize that, because we have different areas that we are able to educate and are able to encourage to sign on to this bill or other bills that you are excited about. Now, in federal legislation, you have 2 senators, and depending on the state, depending on how many people are in your state, you have a certain number of representatives. And state legislation, it works a little differently, and it depends on the state. Every state has senators, not just 2, but the number of representatives that they have in the House can be different, but they also don't always call the House the House. Some states call their House the chamber, or some states call their House. So you have to really know your state when you start to work with state legislation. So know whether or not the law that you are trying to get passed is state or federal, because that's going to affect who you want to speak with. But we're going to focus a little bit, because the Medical Nutrition Equity Act is federal legislation. We're going to talk a little bit about that. All right, so the Medical Nutrition Equity Act. I am totally embarrassing my son right now. The Medical Nutrition Equity Act is a bill that has been, we've been working hard on for the last 13 years. And it is a bill that would force insurance companies to cover the cost of medical food and nutrition. So for our community, think of your Lipostart, think of your Portagen, think of your Monogen. But it also includes in there medical supplements that are prescribed by your physician. So for the greater Mito community, think of your levocarnitine, think of your CoQ10. And these items to be covered are super important, because levocarnitine can cost hundreds of dollars if your insurance company is not covering it, medical foods as well. And this not only affects the FEOD community, this affects the PKU community, this affects the Mito community. And so we're all trying to band together to get this legislation passed. I think there was another picture in here that's missing, but oh yes, it was the one that is, it was supposed to show you the fact that you each have 2 senators, and you want to make sure that you know who your representative is, because that depends on your location. And the reason I keep sharing that over and over and over again is because that was a lesson I didn't understand when I first started getting into this. And I just started calling all the representatives in Georgia and being like, you need to sign on to this bill. And I got a call back from one, and he asked, what's your address? And I said, Atlanta. He's like, you are not even in my district. Why are you calling me? And that's okay. So I learned the hard way. So I am sharing with you my experience. But the most important thing I think to remember as you are diving into this is that our senators and our legislators, they work for us. Okay. So it's super important and very easy to call and talk to them. And it can be, there's various different things that you can do. First of all, let me back up a little bit. So the first thing I want you to know is that so the way that bills go through the Senate and the House is that a bill can stay before, if it doesn't become a law, it has to kind of get recycled in every 2 years. So so you can get a number of representatives to sign on, and that's great. But if it doesn't become a law, then you kind of got to start all over again after 2 years. So with the Medical Nutrition Equity Act, that's where we are. The bill died last year, and so we're reintroducing it to the House and to the Senate this year. So the numbers that you see, House Bill 3783 and Senate Bill 2013, are the old numbers. They will get new numbers soon, probably in the next month or so. And so anybody that signed onto this bill previously, they have to redo it again. So whether or not your representative or your senator signed on previously, you get to call them again and you get to just remind them, hey, you signed on previously and we really want you to co-sponsor again. And you can also, and if they didn't, you can say, hey, this bill is really important to me. And it's really as simple as that. I know it sounds like I'm just talking to a friend, but that's as simple as it is. It really is just picking up the phone and calling the number of your representative, and a secretary will answer, and you'll say, my name is Stephanie Harry, and I'm going to give my old address because I don't know my new address yet. I live at 1092 Oak Street in Atlanta, Georgia, and House Bill 3783 is really important to me. I would like for Representative Williams to co-sponsor this bill. And it's as simple as that. And what they do is they start to tally. So if they get 5 tallies, if they get 10 tallies, and they realize that this is really important, well, then they take it to the senator, they take it to the representative and say, hey, we need to start doing something with this. So rally your troops, because the more tallies they get, the more likely there is to be movement. Now, what if you don't know your representative? That is okay. If you look under number 1, you can see there are 2 quick websites. And, it's as simple as putting in your zip code, and it will tell you who your representative is, who your senator is, and it gives their nice little phone number there. And then all you have to do is call. So it is truly that simple. The other thing I would say is, if you have a little extra energy, when you call, if you can ask them for your health legislative assistance email address. And why that is important is every office has a health legislative assistant, and that's the person that is always reporting to the senator or the legislator about bills that are being brought up in the community and stuff. So if you can get their email address, you can share with them a little bit about your story, why this bill is important, and they will pass it on to your representative. That's also the person you can harass and check in with and say, hey, have they signed on to it yet? Why haven't they signed on to it yet? Can we get a meeting, please? And sometimes you'll get a meeting with just that representative, but sometimes they have community service days, and so you can actually meet with your senator. Now, thanks to Zoom virtually, so you don't always have to go to DC to do this advocacy. But that's an important person to know, and that's a person that changes quite frequently. And so if you take that extra step, I encourage you to contact me and let me know, because we keep a running list of the health legislative assistants, and that's a helpful way for us to keep up to speed with that. So in addition to all of those things, so the PKU community has really taken a lead in this legislation, and there is a website that you can see, nutritionequity.org. So right now, as they're trying to get the bill renamed, if you haven't been on nutritionequity.org yet, I encourage you to go on there because they have several different pieces of educational material that you can take to your representatives, but they also have a section on there where you can share your story. And it's as simple as uploading a picture and sharing briefly about your struggles or why it's important to have medical food coverage for your family. And the reason that is so important is that sometimes you can't make it to DC, or sometimes your kid's in the hospital. So the last thing you're thinking about is contacting your senator. But we do have other advocates that are. And so we can take these stories and say, okay, I am one person in Pennsylvania coming and speaking with the senator, but here are 8 other stories from constituents of who this affects. And so this part is really, really important, and it takes 5 minutes. And I just say that because there's lots of different ways you can get involved. Not everybody needs to make this like a 10-hour-a-week job. It can be as simple as 5 minutes a month, and it makes a huge difference. But you can also get your friends and family involved. A lot of times our friends and family want to be able to help, right? But they don't know how. And maybe they want to cook for your kids and you're like, nah, I'm not really sure that we're there yet. Like there's lots of ways that friends and family want to help, but sometimes I think it's hard to navigate with all of the complexities in our community. How do we get them involved? This is a great way to get them involved. My husband's parents, when we lived in Atlanta, we were trying to get a representative in Pennsylvania to sign on the bill, and they went, and that's my friend Kristen Bonix, and this is my husband's parents, and they went with Kristen to DC and talked to the senators and representatives in DC and to try to push that bill along as a grandparent. So grandparents can go and talk to their representatives, aunts can go and talk to their representatives, friends can go. And so right now is the time before we get the new name for the bill that you can start talking to your friends and family and say, hey, this is coming up, this is in the pipeline, this is what I need you to do. You can also contact me. I have a form letter and I can blast that out too, that you can kind of use as a sample to guide people through, because it can be a scary process for the first time, but it doesn't have to be. Again, it's as simple as just picking up the phone and having a short conversation with the secretary on the other line. So again, if you have any questions, my email address is here, sharry@mitoaction.org, and I would love to talk with you further. You don't have to go through this process alone. It's something that I think is best when we partner with each other, and sometimes we get exhausted and frustrated, and that's okay. So sometimes it's nice to have that extra support from our community as we're reaching out to legislators, because again, this is a process that unfortunately takes time and a long time, and we got to stay at it and stay together with it. So I hope to hear from some of you guys, and if you're in Utah, come and see me because I have a special project for you. So without further ado, Annika is going to come up and introduce Dr. Larson.